Many people with borderline personality disorder also have co-occurring disorders. Here to talk about what this means for those patients is clinical psychologist Dr. Ramani. In other videos, we talked about the 9 traits that go into diagnosing someone with this. But there are a lot of people who have borderline personality disorder along with another disorder. Talk to me about that.
It is very common for borderline personality disorder to co-occur with other severe mental illnesses. The ones we most commonly see are mood disorders such as depression, anxiety disorders, substance use disorders, and eating disorders. So those are the disorders that will often hang out with borderline personality disorder. In some cases, we will also see that bipolar 1, bipolar 2 can also co-occur with borderline personality disorder. Because bipolar is in and of itself a far less common mental illness, it's obviously going to be less likely to co-occur.
Right.
Because borderline personality disorder is such a disorder of mood dysregulation, if you will, it's not unexpected that mood disorders would co-occur with it. And what that does is it raises additional treatment challenges. Because what you want to do is you want to get that mood disorder or that anxiety disorder well managed, because that just becomes one more challenge for the individual with borderline personality disorder to manage. So when a person with borderline personality disorder goes into treatment and they have these co-occurring disorders, you don't treat them one after the other. You do need to treat them simultaneously.
All of it together?
Yeah, all of it together, because it's not like, now what you often will see is that we will treat the more acute crisis first. So for example, if the person is severely depressed, if they have paralyzing anxiety, if they're using drugs in a way that's getting in the way of their life or is dangerous to them, obviously they would either be hospitalized, go into rehab, or focus on that symptomatology through a combination of medication and therapy. But you can't forget that borderline personality becomes a backdrop against which this is occurring. And for folks with borderline personality disorder, engaging in therapy can be challenging, not just for the client, but also for the therapist.
I can imagine.
So it does become a bit of a mixed bag in terms of really needing not only a skilled therapist, but an entire team of psychologists, psychiatrists, and other support staff that help that client, kind of get over the hump. Because there is this sense sometimes, because if you're a person with borderline personality, you can be experiencing psychotic or paranoid symptoms. You may not even believe that the treatment team is working in your best interest, so you'll get pushback.
Right.
So that's why it has to be it's a slower process, and it's a more comprehensive process.
I hear the term comorbid. What is that?
Comorbid is, I actually think, sort of not a very nice term, because it's really kind of a more, medical term for co-occurring. Morbidity implying the idea of illness. That's
so
what
we use those interchangeably.
And I like co-occurring better, because morbidity to me is so much more of a medical term.
Co-occurring
as a psychologist,
sounds much nicer.
I like co-occurring.
Yes.
That co-occurring presence of substance use disorders and borderline personality disorder is also a clinically critical issue to address, because the borderline personality disorder symptomatology can make maintaining sobriety really challenging. So what it means is that upon leaving rehab and perhaps entering sort of after rehab halfway houses, sober houses, 12-step, there also needs to be a very structured therapeutic kind of safety net around that individual to help them when they experience really strong moods like anger, frustration, a sense of abandonment, because all of those may be vulnerabilities to relapsing again.
Is there a higher chance that someone who has depression that they will then develop borderline personality disorder, or is it the other way around?
No, it's the other way around. Personality disorders tend to be very developmental in nature. So for example, someone's not going to wake up at the age of 35 and develop borderline personality disorder.
Got it.
If you kind of rewind that tape on the person with borderline personality, you would have already seen sort of the gurglings of this in adolescence. And then it really takes on full form. In fact, we don't diagnose personality disorders until a person is an adult. Anyone who's ever seen a teenager knows that they're all narcissistic and they're all emotionally sort of all over the map.
Yes.
And that's why we want to be really careful, because part of that is sort of growing into their personality.
Right.
And then around 22, 23, 24 is when we might sort of make our initial forays into saying this is a pattern.
That is a really, really good. And I also love the takeaway of when we have a co-occurrence between borderline personality disorder or anything else like depression, we don't just We do it all.
It has to be.
All.
Otherwise, it's not going to work. And then many times when you have sort of what we call a treatment failure, the client feels like a failure too. So it's to understand that, and it's also understand how much treatment you need. Like sometimes you do need something much more intensive. If a person is binging and purging every day, in the case of bulimia nervosa, they have to be in inpatient treatment.
Right.
A person with anorexia nervosa have to be in inpatient treatment. These are very, very dangerous disorders. And when you add sort of the instability of the borderline personality on top of that, it's potentially quite dangerous. So we're also observing that person medically. So this, again, you're looking at the client's experience as a whole, and thus these co-occurring disorders become critical. And I have to tell you, in all my years of working with clients with borderline personality, I've never met a single one who had only borderline personality. There was always a co-occurring disorder.
Wow.
Always.
Wow.
And I do, well over half of individuals living with borderline personality have at least one other co-occurring disorder. So to keep that in mind, and it's also not unusual for people with borderline personality to have co-occurring medical disorders. In addition, sleep disturbances are almost endemic. Almost everyone with borderline personality, you'll see that there's a major sleep disturbance. They go to sleep very, very late in the night, 2, 3, 4 in the morning, and then want to wake up at noon or 1. It's a circadian dysregulation that's actually considered to be part of the disorder, and that's actually not good for your health either. So we do see problems with chronic pain, sleep disruption, and lots of other medical problems that often do co-occur with borderline personality.
Well, in other videos, you've given great advice on how to approach somebody that you might think has borderline personality disorder and how to hopefully get them into some sort of treatment. So we'll link to that video here as well. Dr. Ramani, thank you so much for being here, and it's always a pleasure to sit down with you.
Thank you, Kyle.
Thanks for watching. Your next step is to head on over to MedCircle.com and sign up for the MedCircle Digest. What is it? Well, MedCircle will send you the latest articles and the latest videos on the mental health topics that matter most to you. So go to MedCircle.com, sign up for that digest, and let's keep this journey on better mental health moving forward.